we are going to keep her, and her name is Emerson. And I figured if he knew her name, maybe he would see her as a life. This is a doctor. He's supposed to speak life. He is supposed to take care of my child, not rally for the end of her.
Today, you'll hear firsthand from mothers who were pressured, intimidated, or bullied by medical professionals to abort their babies because of a challenge with the pregnancy. These compelling stories reveal the bias of many in the medical community, the miracle of life, the pain of abortion, and the incredible healing forgiveness of God. You'll hear these remarkable stories today on this Life Issues radio special, Say Yes to Life, with your host, Brad Mattis, president of Life Issues Institute.
Medical professionals rarely use the A word when advising parents to abort because of a challenge with the pregnancy. They may instead use words like early induction. Parents need to see beyond the nice-sounding words that disguise the ugly truth. God has a plan for every baby, regardless of the challenges that lie ahead, even if that precious baby lives only minutes. This program will equip mothers and fathers to say no to abortion and yes to life.
Stay tuned for Say Yes to Life, a Life Issues radio special.
Jenny Foster is a mother, a writer, and has a Bachelor of Science in Psychology from the University of California, Davis. 21 years ago, Jenny received the news during an ultrasound that her son had severe medical complications. After being pressured by her medical care providers, Jenny aborted her son. But her story doesn't end there. After years of dealing with pain and trauma from the abortion, she found healing and forgiveness through Jesus Christ.
So take us back to that day when you found out that there was something terribly wrong with your baby.
We had been waiting for our 16-week ultrasound. We were going to find out the gender of our baby. It was a really exciting day. And we get to the ultrasound appointment and they do all the things. And the first thing they tell us is that it's a boy. And so we were just elated. And then they started to tell us what was wrong with him. They told us that our son had a large cyst on his kidney and that he had 2 congenital heart defects. One is a ventricular septal defect, and the other was that he had no apparent atrial septum at all, dividing those chambers of the heart. There was also concern that he had what's called a Lemon sign, which could have been indicative of skull malformations. So it was pretty daunting. And I just still remember that exam room today, as poignantly as I did 21 years ago. The air felt like it just left the room, and I was really in shock. And I remember asking the doctors perhaps too many questions, just targeted at, okay, well, can you fix that? How can you fix our son?
Tell us, what was the doctor's recommendation moving forward after you got this diagnosis?
The recommendation was clear from 4 providers. There was a neonatologist, there was the radiologist, our own OBGYN, as well as a genetic counselor that we saw the following week. They all unanimously recommended that we make, again, what they called the compassionate choice, that we terminate the pregnancy.
Matt and Courtney Baker met in college and have been married for 24 years. They live in Central Florida and have 3 daughters, Ryan, Evan, and Emerson, who has Down syndrome. Courtney was pressured to abort Emmy after receiving the diagnosis. Instead, they chose life. God doesn't make mistakes with any of his creations. Emmy is exactly who she's supposed to be, and mark my word, is a gift to all who know her.
It was actually the night before we had received a phone call from the nurse saying that our test came back normal. So when we went in the next morning, we were going for an ultrasound. We took our 2 daughters with us, and they were going to meet their sister for the first time. And we waited for about 45 minutes thinking something's going on. And at that point, the doctor came to the door and said that our daughters had to wait in the waiting room, and took us back to a little sterile room and told us that the test results were given to us incorrectly. And she actually did have trisomy 21. So I think our initial reaction was just shock. We were completely blindsided at that point.
So what emotions were running through your head when you were told that?
I was shocked, but I had enough wherewithal to know that I was not going to cry at that point. The nurse had a box of tissues. I remember that. She was getting ready to hand me a box of tissues, and I said, no, I don't need those. So I just remember trying really, really hard to keep it together at that point for their benefit. It's like I already knew instinctively that I had to let them know that I valued her life.
Well, when you spoke to your doctor, what was his first recommendation?
He was very kind. The first doctor that we had, I feel like he was really almost overwhelmed with us, but it was like he was giving us a death sentence. When he delivered the news, I feel like he just automatically assumed that we were going to end the life of our baby based on the diagnosis. He said he wanted to set up an emergency appointment for us to discuss our options. That is the term that we heard again and again as options. And I said, if you mean abortion, we are going to keep her. And so he set up the appointment anyway, and we immediately canceled it. I think there were only two options, life or death.
Now, he was the initial doctor, but then there was another one after him. Tell me about your relationship with him.
When we first went in, he looked at our chart and he said, it looks like you've decided to keep her. And at that point I said, yes, her name is Emerson. And that is when he said he thinks that we should reconsider and talk to somebody about it because the value of our life, we don't understand how it's going to be raising a child with special needs. We don't understand the impact that it's going to have on our daughters negatively. So we were very adamant about, no, we're keeping her. We went back and he just seemed upset with us that we chose to keep her.
Would you call it a hostile environment?
Yes, but almost like covertly. It was passive aggressive. Yes, that's the best term. Absolutely. Very uncomfortable. We never wanted to go in. He always seemed to find something wrong with her, and he always seemed to take great joy in that. Like it was almost his proof that he was right, that we were going to have such a difficult life with her, because he kept finding more and more things wrong with her.
And he communicated pleasure at finding problems?
It sure seemed like it.
Jenny,
how did you and your husband react to the recommendation of abortion?
We were most definitely in shock. That day we were quiet and we commuted home separately. I remember we had two different cars where we met at the appointment. I immediately went into mom mode. I had a toddler at home, and you want to be present and act like everything's fine in front of your child. My husband went into scientific mode, researching and asking more questions of our OBGYN. And I also remember not sleeping for those nights as we awaited what looked like termination. I just sat up all night, and I appreciated my husband staying up with me.
How far along were you when you received that dreadful news?
We were 16 and a half weeks pregnant, and at the time of termination, from the medical records, we were between 17 and a half and 18 weeks pregnant.
Jenny, you've had subsequent health problems. Do you believe they're attributed to that abortion?
Yes, I do attribute some of them. I'm not going to say that all of the medical conditions that I manage are a direct result of the abortion, but I will say there are some in particular that happened, really in short order after the abortion. Things like, and I hate to get too graphic, but, chronic irritable, they call it irritable uterus and irritable bladder. And I've had to have procedures and devices to deal with that lingering pain. There's a lot of scar tissue. I also ended up with thyroid issues, ultimately thyroid cancer and autoimmune disease. I was also awarded a diagnosis of fibromyalgia to deal with, widespread pain. I told you PTSD. And I was never a great sleeper, but to say my insomnia worsened and that it's still a problem, that would be an understatement. Yeah, I don't believe I'd be dealing with much of that if I hadn't gone through this experience.
Dr. Daniel Wechter is a maternal fetal medicine specialist in Saginaw, Michigan, with over 47 years of experience in the medical field. He graduated from Loyola University School of Medicine in 1974. Dr. Wechter specializes in high-risk pregnancy, including intrauterine growth restriction and pregnancy ultrasound. He and his wife Alice have a daughter with Down syndrome and have fostered many children from families facing difficult situations.
Dr. Wechter, it seems that a significant number of physicians at the first sign of trouble with a pregnancy will recommend abortion. Why do you think that is?
I don't know these different doctors personally, but I suspect that a big part of it is if there's a problem with the baby, if they see a spine defect or a heart defect, I think they have the fear that if they don't do something and this baby's born needs a whole lot of the specialized care, that they're going to be faulted or sued for that. Like it's with the mother. If the mother has some physical problem, maybe she's got a heart condition, something else, I think the easy way out for them is say, just get rid of the baby and then we're not going to be at fault.
What advice, Dr. Wechter, do you have for patients whose doctor recommends abortion when there's a problem with the baby?
Well, I tell what I think about the problem, what the outcome's likely to be, and then I tell them, if anything else, I'd get a different doctor. If they're not just going to push them into having that, they got to change docs. There's a lot of docs here in this town that take good, loving care of them and will respect their wishes.
Courtney, after Emmy's birth, you sent the doctor a letter. Tell me why you did that.
A friend of mine had a post that said after her son was born, her doctor told her, see, I told you he was perfect. And boy, I think I even got emotional at that point because I was just thinking how much I wish I would have had a doctor that would have told me that. And that was really the inspiration for the letter, because I do believe that doctors need to know how to deliver a diagnosis. They need to understand how to do it correctly, because the majority of people out there who I hear from have the exact same experience that I've had. If I could just change one doctor's perspective, one doctor's way of delivering the news and caring for his patients, then maybe I could change the world one person at a time. I think that's how you do it. But I do believe that we really need to get into those doctors' offices and help them figure out how to deliver a correct diagnosis and support the woman, support the mother.
The letter went viral. Why do you think that is? And what kind of reaction did you have to it?
I feel like people inherently are for the underdog. They inherently understand the value of life, whether they consciously know that or not. And this was a mother valuing the life of her child and fighting for her baby. And I think it struck the chord.
The media paid attention to this letter, and you guys did some pretty high-level media as a result of this letter. What was the media's reaction to it?
Very positive, surprisingly. And again, I think it just goes back to it's life. It's what we're supposed to be rooting for. We're supposed to defend. And I think when somebody is doing that, it's easy to get behind them.
I don't even know if Courtney thought when she was writing that the impact that it was going to have on the pro-life movement. It was very specific to our experience with our doctor and with Emmy. And she took a picture of her putting that letter in the mail with Emmy. It was not something that we planned, for sure.
And I think maybe that's part of it too, is that maybe the media got behind it because there was a person. There was a living, cute, adorable little baby, and they could see the after from the before of when we were told that she wasn't worth it, to afterwards seeing this amazing child, and they could see the discrepancy there.
You're listening to Say Yes to Life, a Life Issues radio special with your host, Brad Mattis.
I understand there were complications with the abortion. What happened?
The abortion was done in a hospital. It was a surgical second trimester abortion called the D&E. I won't get graphic, but it was under general anesthesia. And unfortunately, after the surgery, I didn't recover the way they anticipated. I had lingering pain and it was pretty excruciating. So 3 antibiotics later, they said, well, you've got a post-surgical uterine infection, bladder infection. There was also kidney infection. And the antibiotics would help for a little bit, but then this searing pain would return. And it was even difficult to stand up straight. I remember that. So 2 months later, I finally advocated for myself and pushed for an ultrasound. And then we found ourselves in that same building in the exam room next to where we had seen our son bouncing around when he had been living. And same situation, the ultrasound tech left. She came back with a doctor, and I thought, this can't be good. And they told us that we had an incomplete abortion, that we had something called POC, And I thought, what is that? And they said, those are retained products of conception. There was no calling it your baby. It was products of conception. And I unfortunately saw the ultrasound monitor, and that's something I've never been able to get out of my mind, seeing half of my son still inside me. And it made sense to them and to me why I was still so sick and not recovering.
Dr. Wechter, you're a physician that specializes in high-risk pregnancies. What is your process or approach when there becomes an issue with the pregnancy?
Well, it depends. The issue is the mother's health, for example. Say a mother's bleeding hard or she's infected, then I would have no problem interrupting that pregnancy, even if it was early before the baby could survive outside the womb. I had to happen about 4 or 5 times. In case like a partial molar pregnancy, a woman gets severe preeclampsia and she's going to lose her life if we don't deliver her. Or if a mother's got infection in the uterus and she's going to get septic if we don't deliver her. Or if she's hemorrhaging and she's going to lose her life if we don't deliver her. In the 4 or 5 cases I've had like that, I have no problem with ending the pregnancy before the baby can survive, even if it's 18 or 19 weeks, because you can't lose the mom. If you lose the mom, you're going to lose the baby anyway. So those are the rare cases. And I've only seen 4 or 5 of those in my whole career.
For the doctor who does recommend abortion, what would you say to him or her?
I think they're wrong. We're trained to save lives, not destroy lives. And so I tell them if there's some way I can help their patient, I'm going to do that. I've had people come like from the abortion clinic that some counselors talked about having an abortion. I said, I'll take care of it for free. And we've taken people in our homes. We had 3 young women that came to live with us till they were done having their babies, and 6 weeks later, then they went off on their own. So I would tell the doctor and say, I think you're making a mistake, man. Realize what you were trained for. You're trained to give life, not take it.
Matt, God wired the male brain to provide for and protect our offspring. How did you handle this pressure, this bullying that he wanted you to take the life of your own child? How did you deal with that?
I think for me, every time we went into that appointment, I knew that God was with us, and it didn't matter what this man said. He doesn't know the future. And everything that we had read was that it's not what you maybe expected. It's different than, having typical children. Your goals are going to be different for them. They're still your baby. They're still your child.
The pro-abortion physician diagnosed Emmy with conditions that weren't present upon her birth. One of the most serious was a hole in her heart, and he scheduled an appointment for them with a pediatric cardiologist.
We went to that appointment the next day, and the pediatric cardiologist did an ultrasound for, no kidding, 2 hours trying to find a hole. And he brought us into his office after he was done and said, I can't find anything. And he said, normally babies at this age, even typical babies at this age, you would see pinpricks, holes that eventually grow and close up, but I don't even see that. And I asked him if he was a believer, and he said he was. And I said, well, can the type of hole that you were expecting to find heal on its own? And he said, no. When you go from a doctor saying this hole is so big, it is not one that would normally close up on its own over time. From the time that we get that diagnosis to the time that we go into the pediatric cardiologist and he can't even find a pinprick hole, when you see God work like that, it just reiterates that there's nothing that he can't do.
If you could speak now to the hearts and minds of parents who find themselves in a similar situation, expecting a child with Down syndrome, what would the two of you want to say to them?
It's a process, and the feelings that they're going to feel, they have to process those. And they're not wrong. In fact, most of them are probably very normal feelings. But as long as they can understand that they will change when they meet their child. There's nothing to be afraid of, even though it feels so scary, because that baby is going to change their lives for the best.
You have a daughter with Down syndrome, Dr. Wechter. How has your daughter impacted your professional and personal life?
Chrissy's great. She's just a delightful person. She's kind to everybody. She's helped with, we have had about 45 foster kids besides our own kids. She changes diapers, feeds these kids, holds them, gets them to smile or laugh. She's just a good person. I've never met anybody really kinder than my daughter, Chris. So she's didn't change my mind. We knew right, when we got married, we'd take a child with handicap. But she just made me feel like it was a good decision.
Courtney.
The love that I have for Emmy is different. It's fiercer. It's deeper. I don't know. I just can't even describe it. The love that I have for her and the love that we have for her and how she's changed her siblings. And what's funny to me is that everything that the doctor said that based on our quality of life and how this would impact our daughters, he was right, only in the reverse. He has impacted our lives in the most profound and beautiful way. And she has changed who our children are now and who they're going to be in the most positive manner.
Jenny?
When and how did you find healing for your abortion?
Well, it's been 21 years, but in the first few years, I gave myself an A in grief because if there was a book on losing a baby, I read it. And the internet for home use was becoming a thing. And so I joined an online support group, but it was just parents who had been in our exact situation. And so it felt like it justified that we had done the right thing. But things just never really resolved, and I didn't tell anyone outside of that secret online community. It was a secret that I held on to, and it became too much to bear. So finally, 9 years into it, I took that little urn of ashes and I scattered his ashes at a very beautiful pond in a very special park, and that was really the beginning of deeper healing. I had invited Jesus into that experience with me and started to ask questions like, I know he's forgiven me, but how can I forgive myself?
And you found some loving people to walk with you through that grieving process, didn't you?
I did. And honestly, it was toward the end of this healing journey. I was writing a book, started writing this book in 2018. And I thought, I'm good. I can write a book now. I want to help other people. And there were so many more layers of healing that came through the process of just writing the book. And I actually went to a retreat in Tennessee, and that made all the difference in the world. I left there really forgiven and feeling set free. It was amazing.
Courtney?
My message always is that life begins at conception and ends with the last natural breath. That, to me, is what's most important. And that every life is valuable. God doesn't make mistakes. I can't tell you one person, and I've talked to so many, I can't tell you one person who had a choice to make the decision between abortion and life and regretted making the decision for life. I don't know one.
Dr. Wechter?
As parents, we're kind of geared to protect our children. I think it's a much more helpful situation for the parent to know that they did that. They didn't hurt their child. They took a child that had a problem they didn't cause, and they comforted that child.
Matt?
Yeah, when you see God do big things, it just reiterates that there's nothing that he can't do. It's a whole lot easier to trust him on the small stuff now, too, because of what he did.
Jenny Foster?
What message would you have if you could sit down directly with a woman considering an abortion in those circumstances? What do you want her to know?
I want her to know you are not alone. You don't have to go through this alone, and that there are many, I don't know how many, but thousands, hundreds of thousands of people in that situation. And if the abortion is in their past, that they can be forgiven with the Lord. They can be forgiven.
It's a national tragedy. So many physicians recommend abortion for babies when faced with a challenge during pregnancy. It's even more alarming the degree to which they push their pro-abortion opinion on parents. I want parents to know they're not alone. They can and should reject medical advice that includes ending the life of their baby. It's also important for them to know they don't have to take this journey alone. Life Issues Institute and others like us are here to help. If you or someone you know is facing a challenge during pregnancy, remember, you're not alone. Reach out and say yes to life.
When you visit lifeissues.org, you'll find helpful resources such as a pregnancy loss toolkit, information about Jenny Foster's book, perinatal hospice resources, Courtney Baker's letter to her doctor, and insightful research. You'll also find information on other informative programs. Again, visit lifeissues.org for these great resources. Thanks again for listening to Say Yes to Life from Life Issues Institute, where we help you stay informed, more informed than you've ever been.